Good morning, Senators. Thank you for having us and for giving us this opportunity to share with you today. The day before yesterday, two of my Doctors Without Borders colleagues were brutally killed in an attack on Al-Auda Hospital in northern Gaza. They were doctors caring for wounded patients in one of Gaza's last remaining barely functional hospitals. Dr. Mahmoud had recently taken 3 children under his personal care who had lost their parents to the relentless, indiscriminate killings. There are so many of these children, scared, many severely injured or burned, and alone, that medics refer to them with the shorthand acronym WCNSF, Wounded Child, No Surviving Family. Attacks on hospitals are attacks on humanity. There is no justification, legal or moral, for the relentless, violent strikes on civilians and hospitals. Nor is there justification for the complete siege of Gaza that denies civilians the necessities of survival: food, water, medical supplies, fuel to run incubators and dialysis machines. These are forms of collective punishment, and they are crimes explicitly prohibited under international humanitarian law, or IHL. Healthcare facilities and personnel are explicitly protected under IHL. Yet the World Health Organization has recorded 310 attacks on healthcare in Gaza and the West Bank since October 7th. Organized health services have ground to a near halt across northern Gaza as buildings are destroyed, medics killed, and essential consumables severed. Water, oxygen, gauze, IV fluids, painkillers. Imagine your local hospital trying to function without such basics, while under bombardment. Communications cuts and the inability to move safely have also crippled MSF's ability to coordinate activities. My medical colleagues are essentially acting on their own. MSF's organizational support is reduced to the solidarity of being on the other end of a rare phone call or text message. This brutal annihilation of an entire population's health system stretches beyond what humanitarian aid can fix. Doctors cannot stop bombs. The pattern of IHL violations is so repetitive and the disregard for human life so evident that MSF has taken the unusual stance of calling for a ceasefire. Canada should do the same. Now is not the time to equivocate. Pauses may be a hopeful start, but we need a sustained ceasefire. We are already witnessing a humanitarian crisis of catastrophic proportions, and it will get worse if this violent onslaught resumes. A sustained ceasefire would allow MSF and others to reestablish spaces for humanity amid the destruction. MSF has worked in Palestine since 1989. In Gaza, 367 medics and support staff were providing medical care within a fragile health system that, prior to the current conflict, already lacked personnel and supplies. Those colleagues, the remaining ones, are now in survival mode. They need a reprieve. We have teams and truckloads of medical supplies at the ready. On November 14th, a small team of trauma specialists managed to cross into southern Gaza. They are now working out of Nasser Hospital. On November 18th, a bomb blast less than 1 kilometer from that facility resulted in 122 casualties in the emergency room within minutes. Across Gaza, blasts have left tens of thousands suffering from shrapnel wounds, burns, fractures, internal injuries, and amputations. Those are just the direct results of bombs and bullets. 50,000 pregnant women are also at risk, as are premature babies, cancer patients, diabetics, and so many others. And the mental trauma of this scale of violence is difficult to even contemplate. But we cannot mount a meaningful humanitarian response while civilians, including medics and humanitarians, are under fire. We at MSF, like so many Canadians, were aggrieved and outraged by Hamas's deliberate and unconscionable attack on Israeli civilians on October 7th. We are now horrified by Israel's response. My colleagues have witnessed and experienced overwhelming death and destruction, amounting to brazen and repeated violations of IHL's cornerstone principles of distinction, proportionality, and precaution. IHL remains the clearest expression of our global agreement to maintain a space for humanity in war. That space is being crushed, but we must keep defending it. We are asking Canada for nothing less than to defend humanity. We are asking Canada to put its weight wholeheartedly and unequivocally behind a sustained ceasefire. Prior to his death on Tuesday, my colleague Dr. Mahmoud wrote the following ominous words on the hospital whiteboard, which had been used for surgical scheduling. "We did what we could. Remember us." Rather than remember more needlessly killed civilians, including doctors and children, let us do all we can to end this brutality. Thanks again for this opportunity, and I look forward to your questions and comments.